salty diets are leading to health complications around the globe, and the World Health Organization says a massive effort is needed to reduce salt intake. The agency had called for an overall effort to reduce sodium consumption by 30% by 2025, which says it won't happen to meet that deadline without drastic change. A new WHO report shows unhealthy diets a leading cause of death and disease globally. The average person should consume no more than about 5 grams. It's 1 teaspoon of salt per day. However, the global average is estimated to be more than double that. Well, we're joined now by Dr. Christopher Labos. He's an epidemiologist and cardiologist, and he joins us from Montreal. Yeah, cardiology important in all this as we look forward. Dr. Labos, thanks for joining us. Let's talk about why are we so off from hitting this target?
It's because we love salt. Salt makes food taste better. That's the reason why we use it. If you go back to prehistoric times, there was very little salt in our diet. So we have evolved as humans with 2 very important mechanisms. One, we have taste buds that make us crave salt, and we have kidneys that are very, very efficient at holding on to salt. So whatever salt you take in, your body is going to use before it's ultimately excreted by your kidneys, which was fine when we were a hunter-gatherer society and our food had very little salt in it. But now that we eat a lot of pre-processed food, we consume a lot of salt, far more than we need for basic biological functions. And that has, as a consequence, the fact that it increases our blood pressure. It makes us retain water, which is not a great thing if you have other medical issues. And when you have higher blood pressure, that leads to more heart disease, more stroke, more kidney failure. So there are a lot of problems that come with eating salt. And people who have very salty, very unhealthy diets are at risk for all these things, which is why you're seeing the WHO issuing this report. And this is not just a problem for the developing world. You can go to many parts of the world, especially many rural areas, where salt intake is very high. Rural China is a prime example, where it causes a significant burden of disease. And if we could reduce that, if we could get people to eat less salt, we would go a long way to preventing a lot of the medical complications that people suffer from.
Okay, so you presented the problem there. As human beings, we need salt, as all animals do, but too much seems to be, we're getting it in that processed food, even though you think, well, I just put a pinch of salt on here. We're getting it in sauces, we're getting it in food we order in, we're getting it in restaurants. So the challenge is then, how do we reduce the amount of salt we use in everyday life?
It's going to be very hard because about 5% of the salt you eat is the salt that's normally present in food. About 15% is what you add yourself during your cooking or at your dinner table. But 80% of the salt that you eat is added to your food by other people. So it's in restaurant food, takeout, prepackaged food, processed food that you're buying at the supermarket. And that's really, really where we have to target our interventions, in the same way that, a series of legislative steps were taken to get trans fats out of food. We're going to have to do more or less the same thing to get rid of salt from various food products. And some steps have already been taken. A lot of soups now advertise the fact that they are salt-free or low in salt, so they really reduce the amount of salt that's in there. And we're going to have to do that because you, to a very large degree, don't have much control over the food that other people are adding to your stuff. The only thing that you can do is cook at home. If you cook at home, you will invariably be healthier because you will consume not only less salt, but also less sugar and a lot of other stuff that is really, really unhealthy in your diet.
Okay, I want to talk about something else as well, but just before we leave this topic, just the WHO, World Health Organization, saying that if we were to meet this goal of lower salt intake around the world, it could save an estimated 7 million lives globally by 2030. So some stark numbers there.
Yeah, absolutely, and we don't realize how prevalent this problem is and how much of a huge impact it could actually have.